If a snake bites you, go straight to an exorcist. He'll get rid of the venom with his charms. False. If a snake bites you, cut that area with a knife or blade. The venom will flow away with the blood. This is false as well. Or else suck the venom out from the area. Tie a string above that affected part. This is completely false too. There are several myths regarding snake bites in our country. You must have heard a few. It's because of these that more than 50,000 people die of snake bites each year in our country. So today, watch carefully and understand how to prevent a snake bite and what to do if a snake bites. Snake bite safety and treatment. In our country, we have snakes in our surroundings, and many a times they bite us too. We already know that most of the snakes in India are non-poisonous, but the venom of some of the snakes is so strong that it can kill. To know which snakes in our country are poisonous, watch the video Snakes, the Big Four. Snakes are carnivorous. Snakes use their venom to hunt and digest their prey. Venom is a type of chemical. It can have dangerous consequences if it enters a bloodstream. It can even cause death. This is a serious medical emergency. First, let us understand how to prevent a snake bite. Most important, do not let snakes enter your house. But if the prey is present in a house, they will come in. So ensure that there are no rats in your house because they attract snakes. Keep your house and its surroundings clean. Snakes like to hide among stacks of wood, cracks, dark corners and piles of cow dung cakes. They cannot regulate the body temperature on their own. That is why they look for dark and cool corners in summer and for warmth in winter. Before stepping anywhere or putting your hand inside any space, look carefully and ensure that there are no snakes. Snakes hidden in trees, branches, under leaves, in the grass or in corners bite when we accidentally step on them. Wear shoes while working in the fields. You need to be particularly careful while working or walking in dark areas. It's often noticed that snakes bite when it is dark. It's important to use a torch while walking during the night. Snakes can be found by the roadside, in the mud or among plants. You must walk in clear, open spaces. It is better if you wear shoes while walking. If you sleep on the floor, then the possibility of being bitten by the poisonous crate snake increases. A simple means to avoid this is to use a mosquito net. Tuck it firmly under the mattress from all sides. It's safe to sleep on a bed than on the floor. Never tease a snake. It is best to stay away from them. It is also sensible to be aware of what to do and what not to do in case of a snake bite. Watch this information very carefully and always remember it. It might save someone's life. Do not panic in case of a snake bite. Remain calm and keep the victim calm too. This is the time to act sensibly and with courage because it is an emergency and time is very precious. Remember, most of the snakes are non-poisonous. And even poisonous snakes do not always release venom when they bite. Such a non-venomous snake bite is called a dry bite and is not dangerous. But leave this to the doctors to decide. Do not let the victim of snake bites run around. Keep the victim still. Do not move the part of the body that has been bitten. Movement increases the circulation of blood and makes the venom spread faster. Call for an ambulance immediately. Call 108 or 102 for medical assistance or an ambulance. Both these are toll-free numbers and can be called for help during any emergency. But if for any reason there is a delay in the arrival of the doctor or an ambulance, take the victim to the nearest government hospital without wasting any time. Always keep the contact number of a doctor and ambulance handy with you. The practice of taking victims of snake bite to exorcists and fake godmen is quite prevalent in our country. This can prove fatal. If snake venom spreads in the body, no amount of chanting or roots and herbs can help the victim. This is because the only treatment for snake venom is the antivenom that's prepared from the venom itself. This antivenom is available only with doctors and in government hospitals. Venom means poison and anti means against. Remember, extracting snake venom is a dangerous task which can be performed only by professionals trained for this. We will talk about this some other time. Many people cut the affected part with a knife or blade and let the blood flow for a snake bite. They believe that doing this will draw out the venom that has entered the body. This is absolutely wrong. Cutting the blood capillaries can prove fatal and it can spread the venom even more. Some people believe that venom can be removed by sucking it out. This is completely baseless and false too. There is also a practice of tying a string tightly on the site of the bite. One must never do that. This can stop the blood flow and can result in a person losing his or her limbs. Remember, every year more than 50,000 people die in our country due to snake bite, only due to the delay in their treatment. There is treatment available for snake bites. The important thing is to take action immediately. Now a task for you. Go to the nearest health center and talk to the doctor about this. Find out if they have collect information on how antivenom is prepared from venom. Display the survey on a chart paper like this. Your name, name of your village, nearest health center is government hospital, primary health center, private hospital or dispensary. How far is this medical facility from your home? Is antivenom available in this facility? If yes, in what quantity? Name and designation of the person you collected this information from. Share this information. Remember that snakebite is our problem. Be alert always and stay safe.